we will reject the request. And if you are including our criteria, and if you including our criteria, we will accept your request and refer you to medical service providers that CWS is cooperating with. So specifically talking about mental health referral scheme, if you have any requests regarding mental health services, including psychological counseling, psychiatric assistance, or mental health emergency situation, you can contact us through CWS hotline number. For psychological counseling and also psychiatric assistance, you can text us through WhatsApp chat. And for mental health emergency, you can call us right away. So after we receive those reports, we will do a quick assessment, rapid assessment. For psychological counseling, if we already conduct a rapid assessment, we will putting those in psychological waiting list, and also after that scheduling appointment with psychologists. For psychiatric assistance, after conducting rapid assessment, we will decide. Our decision will be based on particular considerations like severity, assistance status, referral from the doctor or psychologist, and those are our considerations for deciding. And then if you or any of you, any people around you, any refugee have any mental health emergency, such as suicidal attempt or self-harming, you can just call us right away through CWS hotline number, and we will sending you right away to psychiatric hospitals emergency unit. Is my voice clear, Hilda?
Yes, it's very clear.
Okay, good. So I will continue. So far, we have some partners, including independent practice counselor. That we have 5. We just signed. They just signed MOU, memorandum of understanding, which document for us can have a cooperation with them. There are 5 psychologists. Sorry, and also we have 4 mental health service providers until now, and 2 psychiatric hospitals, including also there's RSUD or other government hospital with psychiatric service. So if you're wondering how many in our psychological counseling waiting list, we have 120. It's way more decreased than last year and last 2 years, but still it's a little bit high number comparing to the resources we have right now. Though we have additional psychologists who sign MOUs with us, but I think it's still not enough to cover this all in the short term. And also why we have such a long psychological counseling waiting list. First of all, we have limited resources, and the second, we also have to prioritize the case. In this context, we have some urgency level. It is low, medium, urgent, and emergency. As you can see on your screen, that for low, it refers to individuals with mental health problems, but these problems do not interfere with their functioning as humans. So let's say it's lack of sleep or stress, just mild stress. Yeah, and then for the medium, it refers to individuals with one or more mental health problems, and these problems are very disruptive to their functioning as human. So in medium, we including people who has maybe continuous problem with family, um, losing appetite, which leading to low intake, um, sometimes feeling body pain without knowing the reasons. We including that into medium, yeah. And for urgent level, we referring to individuals with at least one mental health problem, and these mental health problems severely interfere with their functioning as human. So in this level, we are included SGBV case, sex gender violence. Uh, yeah, that's the thing. And also for emergency, uh, we consider we consider that as emergency uh, uh, when it comes to the suicidal attempt or and self-harming. Yeah. So um, in order to be in order to improve our implementation of this mental health and psychosocial support, we are trying to extending our activities into some uh, event or some activities. Yeah, so there's a psychoeducation, psychological first aid, and peer counselor, support group, assessment, mental health apps. So in psychoeducation, we are trying to, it's still in the making, yeah. So in the psychoeducation, we're trying to uh, make a webinar or learning activity with psychologists or competent speaker. And also in psychological first aid, we are trying to the purpose of this psychological first aid training is to increase the knowledge and understanding about mental disorders and also reduce stigmatization. Um, Also equip refugees with simple skills to help others who experience mental disorders. Also make estimation of the risk of suicide and self-harming behavior. There is also a support group. Uh, it it's more like leaderless discussion, and also support group, including survivors or people who have had the same problem experiences. Yeah, and uh, assessment. Yeah, we're trying to do screening, uh, rapid assessment, so we can have more information regarding mental health problems in community in context of refugees, and we can have further information as well, more information regarding the effectiveness of uh, implementation intervention. We are trying to build cooperation with some mental health service providers as well in technology context. So uh, there is one mental health application who can manage the anxiety disorder, and we are trying to liaise with them. So yeah, I think that's all from me. If you have any emergency, this is the CWS hotline number. You can contact us because this is available for 24 hours, only for emergency. Thank you. I'm over to you, Hilda.
Okay, thank you so much, our sister. You were really on time, and I think that with this information you have given us, it has gone a long way. It will go a long way to at least relieve some of us from the mental health, to know our well-being, Thank you so much. So now we are going to take some questions. This is the first question and answer session. So in any session, in any question and answer session, we are going to take 3 questions. So I will start with the first question. So I'm going to give the 3 questions. I will give the name of the person and the person's question. So please just be patient. I will ask the questions right now. Our first question is from Al, the name is very difficult, Ahada, to the UNHCR and CWS. His question is about the possibility to assign a WhatsApp number or an email for psychological counseling, that every single refugee be able to reach and explain his or her own psychological issues easily and get the required, and get the required consultation. So he's trying to say, is it possible? Let me put the question this way. Is it possible to assign a WhatsApp number or an email for psychological consultation that every single refugee can be able to reach and explain his or her own psychological problem issues easily and get the required consultation? That's the question.
Okay. I think I will I will try to answer. Or Mbak Ray want to try to answer?
Go ahead, Mbak Ayu. I will answer after you.
Okay. So the question is about how to access the psychological counseling or any assistance regarding mental health issue, right?
Yeah, that is it possible for you people to create a WhatsApp number or an email where the refugees can go directly, can consult the psychologist directly?
Yeah. So as I mentioned before, that so far for now we only receive the support for all the health concerns through the HOTCWS hotline number. Yeah. So you can, if you, as I mentioned before, if you have any concern regarding or you want to request regarding psychological counseling, yeah, and also if you want to psychiatric or you want to visit psychiatrist hospital, you have to follow the regulation. You can text us through WhatsApp chat, and then we will consider. But so far, as long as I've been working in CWS, we never reject anyone. Sorry, we never reject anyone who request who request psychological counseling. Though they will wait for a long time, but we never rejected someone to request psychological counseling. But for psychiatric assistance, it would be more consideration on that. Yeah, so we consider about the assistance status regarding the security. Do you have any referral letter from the psychologist or the doctor from HOTCWS, any other hospital or not? There's so many considerations of that. So yeah, if you need any assistance regarding mental health issue, you can just to WhatsApp, and we will give response uh, on how which is every Tuesday and Thursday.
Okay.
Is that answering the question?
Hello?
Hilda, can I add something from Mbak Ayu?
Yeah.
Can you hear me?
Yeah, we are all of us, we can hear you.
Okay, good. Okay, Hilda, thank you so much. And Mbak Ayu, thank you so much for the okay. Thank you so much for Hilda, I think there is can you try to mute first? I think from your side, and then okay, good. Thank you so much for that. Still, there is a sound after me, but yeah, I'll try. Okay, from Mbak Ayu, thank you so much for the answer, Mbak Ayu. Yeah, that's true. Until now, it's only one phone number, but it is actually a very good input and feedback from your side. From what we can do here is I'm gonna take notes on your feedbacks and inputs, and we'll try to discuss it internally whether it's something that we can do, whether it is possible, and whether this kind of this feedback also can improve the the accessibility to the mental health care for refugees, because having like one facial number, for example, for the mental health care, maybe can improve the access for that. But thank you so much for the feedback. It is noted on the input from your side. Thank you so much, Hilda. The floor is yours again.
Okay, thank you so much. Let's take the second question. The second question is from Ibrahim Wadi to UNHCR and also to CWS. How do we end or at least maximize the mental issues among refugees in Indonesia? Why the reason of creating mental illness are well known by UNHCR, NGOs, and government because of the refugees, because the refugees have been in Indonesia, some of them for almost a decade without human rights, without human rights and unknown future. Did you get the question?
Yes, Hilda. Thank you so much. I get the question.
Okay.
I'm going to try to answer about the questions, but also other colleagues here can also add to that. So we understand that it is, for some of the refugees, it is quite long time that you are here. Um, some of you may, waiting for, the resettlement to come, but it is very limited. The quota is very, limited as well, and that's why that the period for that is quite long. But from my side, I would like to, remind you again that if you feel that you have the early warning sign of the mental health, for example, if you see yourself that eating or sleeping too much or too little, pulling away from people and usual activities, feeling numb or like nothing matters, or feeling helpless or hopeless, or even like doing self-harm, or other the early warning signs that you think that you are not yourself again during this journey, please try to reach out to our hotline number through CWS, so you can get the care that is necessary for you, which is the mental health care. And aside from that, I would also advise that you utilize uh, the journey while you are in Indonesia. Yeah, we hope that, for example, if there are the education activities or livelihood activities being provided by organizations, be it the UNHCR, GRS, SWAC, or other organizations, try to follow that as well, so you have quite meaningful activities while you are here. So I guess that's from my side. If the other speakers would like to add, please do so. Thank you so much, Hilda.
You're welcome.
Yeah, just adding some things on Mbak Ray's answer. So I think from CWS side, we already did what we could do to minimize the mental health issues if you really if that is really what you mean. So uh, how we minimize the mental health issues occurring in Indonesia in the context of refugee. So we're trying to arranging psychological counseling. We're trying to do a webinar. We are trying to uh, extending the cooperation with other mental health services, uh, trying to trying to get more psychologists for being here for refugees. So at least that is the thing that we could do. Other than that, it would be depend on the personal how to handle their emotion, how to handle the the mental issue within themselves. Yeah, but of course, if you think that you cannot handle it, we suggest you to seek the expert, which is in this context, you can contact, which is in this context, you can contact CWS through hotline number or to chat or any call if there's any emergency. That's from my side.
Okay, thank you people very much. We go to the third question for this first session of the question and answer. The third question is from Eliza. It said, does UNHCRO and CWS has explored more resources for professional counselors to address the long waiting list? Are there any government institutions that provide these services? Maybe KEMOSOS or KEMEKES? Did you get the question?
Yes, Hilda, we get the question. I will give the floor first to Mbak Ayu while I will add later.
Okay.
Oh, okay. Uh, yeah, we are having cooperation with some hospitals that provide uh, mental services as well, as mentioned before, and also it is coming from the government side. Yeah, and then also we are having. I think a problem with laptop. Uh, could you please help me to answer the question first, Mbak Ray?
Sure, Mbak Ayu. I guess from my side, since actually CWS has more, answer to that, but I'll try to answer from your side that we actually is trying to have more and more and more, collaboration, not only with the government but also the independent organizations that provide mental health care, including the pro bono services of the professional counselor, for example, that are having the focus on the mental health for refugees, for example, and would like to give it for free, for example. We had that kind of experience last year, and we are trying to have more collaborations with the other be it the individual or also the organizations that focusing on the mental health care. Yeah, that's from me. I'll give it back to Mbayu. Thank you
Yeah,
so much.
thank you, Mbak Ray. So as I mentioned before, that we are having 5 additional psychologists, and also we have 4 mental health services organization, and 2 psychiatric hospital in Jakarta and in Bogor. There are also uh, hospitals with psychiatric therapies. So yeah, but I think there is uh sorry. So uh I think there's also we still need more psychologists and mental health services for this long waiting list of psychological counseling, and also to cover all the mental health issues in context of refugees. There are a lot of work to do for this program implementation. that is from my side.
Okay, thank you people so much for this first session of the question and answer. I hope for those who they have already answered their question, I hope they are satisfied and they have got something that will go a long way to clear their doubt. So we take the second session of the questions. In this second session also, we have 3 questions. The first question is from Nasamba. The question goes like this. Good evening, everyone. My question is there, as refugees, do we have our special hospital as refugee? Because nowadays, people get scared of going to hospital. How can we know that someone have mental problem? Did you get the question?
Yeah, I get the question.
Okay.
I got the question. So, how can you know that? Yeah, how can you know that you have a mental health issue? Is that the question?
The question is like this. As refugees, there are like 2 questions in one. As refugees, do we have our special hospital?
Yeah, okay.
As refugees, because nowadays people are scared to go to hospital, how can you know that someone has a mental health problem?
Yeah. So, as I mentioned before, that actually I don't have any psychological background, but I'm just learning by doing, by working in CWS, and also I've seen, I've talked a lot. I'm having conversation a lot with the psychologists and with who are having collaboration with us with CWS. And yeah, the thing that you can use for identifying yourself is, as Mbak Ray mentioned as well previously, that you can identify by if there's any abnormality in your habit, like you are losing your appetite, you're losing your appetite, your lack of sleep, you are crying without reason, you are having maybe body pain without knowing any reason, and you have nightmares maybe, or yeah, you feel so stressful regarding the situation, and crying a lot. Maybe it is some of the many symptoms that you can use to identify. And then once again, I suggest you go to expert, at least if you really want to consult with the health officer in Puskesmas. The doctor also can help you to identify to identify the problem and give you the diagnosis if you really have a mental issue. Yeah. Yeah, and I think this is just opinion. Yeah. Feel free to add or to not to agree, or to disagree. But for me, everyone is having mental issue. Yeah. But the difference is just level. So the difference is just level and how we cope with that stress. Uh, yeah, that's from my side. And also for the second question, okay, I would like to add something as well for the first question. So if you have any mental health problem, you can contact us as well, CWS hotline number. If you really need to talk, actually we just received the psychological counseling request or mental health issue request through WhatsApp chat. But if you really need to talk to us, you can just make an appointment with us, so we can do a counseling and do a conversation regarding this one, and deciding which way we can help you. And then for the second question, which is there any specific hospital for the refugees, or for the in the context of mental health? Actually, we have, as I already mentioned as well, that we have 2 psychiatric we already have a collaboration with psychiatric hospital, which is in Bogor and also in Jakarta. You know that as Rumah Sakit Soeharto Herja RSJ Grogol, and also Rumah Sakit Marzuki Mahdi in Bogor, in Jakarta, in Bogor. Yeah, for specifically for refugee, uh, uh, they serve any people with regardless their citizenship, regardless their race and others. So I think that's from my side. Is that answering your question?
Yeah.
Mbak Ray, you want to add something?
Thank you, Bayu. I will add some points to that. That actually, from UNHCR side, we would like as much as possible not to have a parallel system in terms of healthcare. So it includes the mental health care. By saying not having the parallel system is we would like as much as possible to have like one system which is under the national healthcare system. So if you say that there is a hospital that has been, in collaboration with CWS and UNHCR. That hospital is also part of the national healthcare system. It is better. So we don't really, separating between, the Indonesian and refugees, because refugees should be included also in the national healthcare in the mental healthcare system, for example. That's the first question. And also the second question regarding how do we know if we have the mental health issues, for example. There are actually some signs that is very that is more what is it visible, and also some signs that is not really visible. If you find yourself in the sign that is quite visible for yourself, for example, that you uh, 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 for example, that you are thinking of harming yourself or others, or you are being violent to the members of your families, you feel that you are more angry easily to a person. That is something that you can easily recognize, in the SD early warning sign. Once you recognize that, we would advise that you, as you to directly reach out to CWS hotline numbers. But there are also some signs that is not really visible, but you can recognize it as well, and you can try to reach for help to CWS hotline numbers. For example, some signs that is quite mild, such as not really having appetite, or you sleep too much, or you sleep too little. You don't want to be with the people, and pulling away from your closest circle, your usual activities. For example, if you teach and you don't want to teach anymore, like you are easily tired, having low energy, and feeling numb. um, and it could be like psychosomatic, like you're feeling unexplained aches or pains in your physical bodies, but after medical check, for example, there is nothing in your body. So it could be also part of the impact of these mental health issues. So you are the one who can recognize as the first early warning signs in your body. And once you recognize it, if you feel the need to reach out, please reach out to the hotline numbers. I think that's from my side. Thank you so much, Hilden.
Yes,
Okay, thank you so much. We take the second question for this
yeah.
second session.
Hilda,
And
I just want to add something that I agree with Mbak Ray from UNHCR that uh, every patient, every patient, regardless their nationality, regardless their races, regardless their skin color, they are having equal right to being treated. Yeah. Uh, so yeah, I since I've been working in the CWS, I've never seen any how can you say that? Any discrimination. Yeah,
Discrimination.
yeah. I've never seen discrimination as long as I know. As long as I know. So it's a good sign. So it's a good sign for us as well. So we can see that everyone is treated equally in context of accessing the healthcare in Indonesia.
Okay, thank you so much. This next question is not, it doesn't start really like a question, it start really like something you already talked about. It's from Zach to CWS. You mentioned that only 102 people have requested to receive mental health support. The number is not the representative of the number of refugees dealing with mental issues. Just off the top of mind, I can think of at least 20 people who deal with mental health related issues. Why do you think that the number is so low? And do you think that lack of helpful responses from concerned organizations to other health related issues have something to do with refugee lack of trust in the concerned organizations? Did you
Okay.
get the questions?
Yeah, I've got the question.
Okay.
So it's a good question, Zach, actually. Yeah, from my side, the number is already decreased from the past years. Yeah, uh, previously we have more than 300 of or 400 even in the psychological counseling. The thing that why the number is so low, because um, you think it's so low, yeah, but actually we also find difficulties to arrange all of them into psychological counseling and psychiatric assistance. Anyhow, why uh, why we only have that number? Because we only put someone into our waiting list when they come to us and request the psychological counseling. So it's an passive, yeah, not if we are not actively asking to other, how about your day, how is your mental health issue, how about your mental health condition. uh, it's kind of limited resources as well, why we don't do the active assessment. uh, that's why the number, that's why we have that number. But actually this year, as I already mentioned before in my presentation, that we are trying to do screening. We are it's in the making. We're preparing the form, we're preparing the technical implementation, how to do this, so we can know further information regarding uh, the mental health issue in the community, and how 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 much the effectiveness of the uh, mental health and well-being implementation program we have right now. So yeah, it would be our input as well. So thank you.
Okay, thank you so much for your response. We go to the third question, still to CWS.
I think Bare want to add something.
Okay, can I hear there? Is it okay?
Yeah, you can.
Okay, thank you so much. Just to add, actually, having this, you say that it's quite low number. Actually, we actually need your support as well. Communities in this context also has a very big role as well. To also supporting your fellow refugees, but also supporting us NCWS as the healthcare providers to, for example, for the identification. If you think like if you find someone that is, having the signs self-harming, being, not being themselves, like being being violent to, their friends or their families at home, and that you think that they need mental health care, you can actually try to let us know, give us information either through CWS directly or through the CBP, but also ask for the consent first to the individual, whether it is okay if, for example, you give this information to the UNHCR or to CWS, and if they need help for this, because consent is also very much important, but also the information regarding and the identification of the refugees with the mental health issues, it is also important, so we can do the more identification, and we know like someone that is at risk more in the communities that we don't know, like because they don't reaching out to us. So yeah, that's part of the role of the communities on the identification, and we hope that you can play that role. Thank you so much, Hilde.
Okay, thank you. Let's take the third question. The third question is from Anemos to CWS. The refugees, they face a big problem because the post-mass program does not refer emergency cases from refugees to the hospital. It asks refugees to go directly to the hospital, and the CWS refuses to do so. If there is any emergency, that CWS asks refugees must go to post-mass because it only refers the local population. For refugees, they refer to a specialist doctor. How do we solve this problem?
Okay, I've got a question. Thank you for the question. So, I will explain a little bit regarding the emergency. Emergency means you or someone in the particular situation that required immediate treatment within minutes or within hours. Okay, so there is some classification as well for which kind of emergency can be treated in puskesmas, and which kind of emergency can be treated in hospital. Or actually, we are just trying to refer someone in emergency case, in emergency situation, to the nearest healthcare facility. Yeah, that is the first thing. And second, uh, if it's emergency, uh, the doctor will not refer you to the specialist. If okay, in case there's someone having think that they have an emergency situation, they go to puskesmas, and puskesmas said, we cannot have it, and we will write you letter to specialist. Yeah, so it means it's not emergency because the doctor not referring you to any emergency, but to specialist, which is can be postponed if the doctor refer you to specialist. But if the doctor in must refer you to any emergency, so it is emergency, and we will cover the expenses, of course, if it's emergency. Yeah, that my answer. Yeah.
Okay. Okay, let's take the next question. Okay, we already finished with the second session of the question and answer. So we go to the third and the last session of the question and answer. This question is from Ibrahim Wadi to UNHCR. The question is for refugees who have mental problem issues. Does UNHCR consider them as mental case for resettlement? And also, what about the resettlement countries? Do they accept refugees with mental ills?
Thank you so much, Hilda, for the question. I guess from our side, the most important thing to do for refugees with mental health issues, is to provide the access to mental health care. So as much as possible, if it can be treated here in Indonesia, we provide that as much as possible, so he or she can access the mental health care in directly, not not waiting for the resettlement or waiting for the other countries to accept, but during the journey here, if it is available, our focus is to give the access to the mental health care uh, providers that are in Indonesia. Meanwhile, for the resettlement, since I'm from the comprehensive solution unit, it will be better if you directly, you know, give your question directly to Kobo Inquiry and directing it to the comprehensive solution unit directly. Thank you so much, Hilde.
Thank you so much for the answer. So I think this should be the last question for the day. The question is from Zach to UNHCRO and CWS. I would like to ask if there is any proper program or plan to train refugees and help them become counselors and help their fellow refugees. I think it will help more refugees to come forward and share about the mental issues they daily deal with. Serious mental related issues shared during this session can be shared with professionals and at concerned organizations. Did you get the question?
Yeah, I've got a question, I guess. So, yeah, as I mentioned earlier in my presentation, that in the plan of the psychosocial support, we are trying to make something called support group or peer group. Yeah, yeah, peer group. The name is peer group. So we cannot promise anything. We cannot promise anything right now, but we are trying our best to make that kind of project, as Zach already mentioned, that including including the community roles to engage in this kind of issue. So yeah, it would be our uh, homework as well for making this well. Mbak Ray?
Thank you so much, Mbak Ayu. That's actually a good plan that we have for this year to have a peer support. And as the feedback is very much meaningful as well. That it is actually quite beneficial if we can give the training as well to the peer support for the psychological first aid, for example, so that if later they found like their friends having the mental health issues, maybe they can give the psychological first aid first, and then um, later on they can report it to the to the healthcare providers, to CWS or UNHCR, so the friends can have more treatment by the professionals. But as a peer, yes, it will be needed and necessary to have that kind of training. Thank you so much, Marayu and Hilde.
Okay, thank you people very much. I think we have come to the end of the question and answer session. We took 8 questions for this meeting today. I hope each and every one of us that asked the question, they are okay, they are satisfied with the way the questions were being answered. I also thank you people for taking your time to answer these questions. So now I think we will go to the closing remark from the speakers.
Thank you, Hilda. Maybe I can go first before Bayu. I think from my side, I would just say that mental health issues, it needs like everyone to act on it. So it's not only UNHCR, it's not only SWAC, or it's not only CWS or other organizations, but also from the communities itself. As we discussed before, that for example, the identification or giving, giving the psychological first aid, for example, once you already get the training, whenever you found your friends having these mental health issues. And so it took like everyone to really have a role on it, and to actually really care and give the support to those who are in need of the mental health care, in particular in the refugee context. I think that's from my side. Thank you so much, Julia.
Okay. From my side, I couldn't agree more with Mbak Ray from UNHCR. So yeah, no matter how many programs we make for this issue, for this mental health issue in context of refugee, if there is nothing from if there is less action from the community itself, it would be less effective. Yeah. So really need your support as well from the community, from the support group, so can get along the way well. And also, once again, I want to remind you, if you have any sign of mental health issue, uh, you can share to your friends, your closest one, and if you need to seek help, you can contact CWS through hotline number, through WhatsApp chat. Thank you.
Okay, thank you people so much. I hope everybody that attended this meeting today, I hope they are satisfied. For those who asked their question, I hope you people are okay with the answers they gave you people. I think this meeting has really, I for one, I have learned a lot, because sometimes we face those type of things because we don't know what is happening, we don't know anything. So I really appreciate you people for the time, for organizing meetings like this. You people are really educating us. You people are really making us to belong, because sometimes with this type of meetings, we really feel like we are with people that feel our pain. So I really appreciate this SWACA for organizing meetings like this. I also appreciate the speakers from CWS. I also appreciate the speaker from UNHCRO. Thank you people very much. Thank you for the time. I also appreciate the people that took their time to attend this meeting. Mr. Julio, I appreciate all of you for the good job you people have been doing for us. By so doing, you people really make us to feel like we belong in Indonesia. I thank each and everyone that took their time to attend this meeting. It has really gone a long way to enlighten many of us. Sometimes we have mental problems because we don't have people to talk to us like the way you people did today. So it has really gone a long way. And we promise back in our communities, we will try to spread the information for those that were not able to attend the meeting. We will try to spread the information, and also try to, if there is any case of mental case, if we see any signs like the way you people show us today, we will not hesitate to communicate to you, so that together we work as a group. Thank you people very much for everything. Thank you for making me to be your facilitator for the day. I appreciate and thank everybody.
Thank you so much, Hilda. Can we have a group picture with the speakers and also everyone here who would like and willing to open up their camera and take a group picture together?
Okay.
Okay, everyone, ready? If you want to get captured instead of a pictures together, please turn on your camera. Okay. Please look at the camera. 1, 2, and 3. Okay, thank you so much for today. Applause for
Okay,
every one
thank
of us.
you.
Thank you for both speakers and also for the facilitator, Hilda, who's done a great job here. Thank you.
Okay, thank you
Have a
so
great
much.
day, everyone.
You're welcome.
Thank you very much. Thank you very much.
Thank you so much.
La sœur Ida, thank you, félicitations. Pas
Merci,
janvier.
merci.
Ok, courage.
Merci.
Viviane, Nansamba, tout le monde de notre communauté qui ont participé, merci beaucoup pour votre temps. Antonio, merci beaucoup. Pas janvier, Tendoric, Ricardo, merci beaucoup à tous.
Merci beaucoup, Roger, et votre communauté.